across the country, withdrawing OPD and other services except for emergency services. Repeated delay in NEET-PG counselling have irked these doctors. They say that they are already overworked, and if another COVID wave comes, it will overburden them even further. And amid all this, there's a shortage of doctors at the moment. In fact, if you are to believe, they are saying there's a shortage of 40,000 doctors in the country. And from today, Karnataka doctors are also joining the strike, demanding payment of COVID risk allowance and timely payment of stipends. Let me go across to my colleague Neha Hebale. Neha, what we can in fact see is that there are doctors, of course, resident doctors from across the country who are facing certain issues, primarily with regard to the fact that there's a shortage of doctors. And now we can see that Karnataka doctors are also joining in. What are their specific demands, if you can just tell us in a few more details? In fact, we'll go back to Neha Hebale in a bit, but as we said, that this resident doctors protest has been going on for the last couple of days. At the moment, what they have done is in some hospitals across the country, they have withdrawn their OPD services. However, emergency services are still as they are still operational. But what we can in fact see is that because of complaints of overburdening, shortage of doctors, which is why lots of resident doctors in multiple cities have gone on strike. Let me go back to Neha. Neha, please tell us about the specific demands of doctors in Bengaluru in Karnataka.
Well, we've been seeing for quite some time now, more than almost about 8 months, how doctors or resident doctors in Karnataka have been putting their demands forth in front of the government, but it's not really been yielding anything. And one of the top demands of the resident doctors over here who are actually boycotting the OPDs today actually is that they be paid this COVID allowance that they were promised. In fact, it was almost about 10,000 rupees per doctor that was promised to them, but the government, in fact, so far hasn't really acted on this. And apart from that, also the fact that many of the doctors over here have had an increase in fees by almost about 400% in just 1 year. So that is also another demand that they had actually put forth. And so far, the Karnataka government that had actually promised this COVID stipend or this COVID allowance to the doctors has not really acted on it. We saw how, in fact, in Mysuru district also, doctors started protesting. In fact, from as early as November 9th, there was an indefinite strike that was announced. But so far, the government hasn't really blinked. And today also, in fact, we're going to be seeing across medical colleges in Karnataka how doctors are going to be, sort of be abandoning the OPD. And this again is going to be an indefinite strike, and we'll have to see what exactly it takes for the government to actually meet their demands. Because let's remember that while of course the resident doctors are abandoning the OPD, there are several patients today who are going to be walking into these OPDs in need of their services.
Right, Neha, thank you so much for joining us with that.